titled Building a Pandemic Resistant World. It is absolute privilege to welcome Dr. Reddy, Dr. Trehan, Dr. Guleria, and Professor Gangopadhyay to this panel, to this plenary session. The topic is a very different one from what we have been listening to since the last 1.5 days almost. We have been primarily focusing on the business, on the financing side, on the recovery side, how to recharge SMEs and so on and so forth. This session, in my mind, is probably at the core of the issue of all the problems that are facing. It deals with public health issues. It deals with how to keep our people healthy, safe in the midterm, short term, and the long term. The topic is actually very complex. I really don't know whether it is possible to build up a pandemic-resistant world. But given the complicacy of the topic, I hand over to my able colleague, Sukumar, to steer us through this topic with the help of an eminent set of panelists. Over to you, Sukumar.
Thank you, Shubho. And good afternoon, everyone. The panelists need no introduction. All I have to say is everyone on the panel as doctor before their name other than me. So it is a truly eminent panel. We have Dr. Sangita Reddy, who is the Managing Director of Apollo Hospitals and the President of FICCI. We have Dr. Randeep Guleria, who is the Director of AIIMS and in many ways at the forefront of this fight against COVID from the policy side. We have Dr. Naresh Trehan, Chairman and Managing Director of Medanta and one of the country's best known doctors. And we have Dr. Shubhashis Gangopadhyay, who is Research Director of IDF, Dean of Indian School of Public Policy, and an economist. We are here to discuss building a pandemic-resistant world. And the way we will structure this panel is each of the panelists will speak for between 3 and 5 minutes. And then we will discuss the issue. I will pose a few questions in turn to them, some questions to multiple people. In many ways, I think we can look at the situation and say that everyone has either dealt with this pandemic reasonably well or not dealt with it well at all. And the reason why I say reasonably well, despite deaths in excess of 1 million around the world and cases in excess of 40 million around the world, is because I think over the last 8 months, the kind of the pace of progress that we've seen in research, the kind of therapies that have been tested, that have been proven, some have been unproven, but which is even better, right? I mean, it's good to know what works and what doesn't work. The pace of vaccine development, never in the history of mankind has a vaccine been developed in less than 4 years. The previous record was 4 years, was for the mumps vaccine. And here you have a situation where you'll probably have a vaccine in definitely less than 18 months, right? Hopefully even sooner. So I think there are two ways in which we can look at it, but I won't take away any more time from the panelists. Dr. Reddy, I'm going to ask you to go first. The focus of the discussion is on how the government, our health agencies, our industries, how all of us can work together and build a pandemic-resistant world. And I think Shubho put it very well, right? I mean, one of the things that he mentioned was, can we even build a pandemic-resistant world? So, all yours.
So, namaste and good afternoon. It's a privilege to be amongst such intellectual people. My first disclaimer is that I'm not a medical doctor, but very happy to be with Dr. Guleria and Dr. Trehan and, of course, Dr. Gangopadhyay. I believe that, much has been said about the COVID and the coronavirus and the downstream impact on health, on lives, on the economy, and all levels of disruption, whether it's the supply chain, the geopolitical shifts, all of them have been significant. That at no time in the history of the world has ever healthcare been so central to every theme and every topic. And I think it's very important for us to really talk about building preparedness, or like you're calling this, a pandemic resistant environment, but also at the heart of it is building a stronger healthcare system. And that's the crux of it. So stronger risk surveillance, managing pandemics better, stronger healthcare infrastructure would all be pandemic related. But I think we need to acknowledge the fact, like Richard Horton, the editor of Lancet, he said that COVID-19 is what everyone's talking about, but this is not a pandemic, this is a syndemic. And here you have two diseases. One is the infection of SARS and COVID, and then the underlying epidemic of non-communicable disease. And that is making the impact of COVID even worse. So we look at it as an overall strengthening of the healthcare system, which I think is important. So whether it is universal health coverage, insurance, and the government has embarked on a tremendous job on Ayushman Bharat, then I believe the combination of that and the insurance for all sections of people will be an important building block in this vision of accessible, affordable, and high quality care. The next one is really primary healthcare. And in this, I think we have to reimagine and rethink the processes, the policies, digital adoption, patient-centric approach, collaborative, public-private approach to patients, really putting the patient in the middle, and then appropriate partnerships with policy makers, private sectors, academia, R&D, and non-government organizations all coming together in this patient-centric, healthier world environment. I also want to just re-highlight on the non-communicable disease aspect of it. I think WHO did this study which said they had surveyed 155 countries, including India, who said that 53% of people had disrupted services for their hypertension treatment during the COVID period, during the pandemic. 42% of them had been irregular in their diabetes and related complications. About 30% said cancer treatment had not been taken appropriately. And if we look at it, the overall impact of untreated or going in the same way of non-communicable disease was estimated by McKinsey and another global organization that the potential impact would be $30 trillion by the year 2030, which is over 40% of the global GDP. So I think at the same time as we're reimagining, rethinking a stronger environment for pandemic, a faster, and like you rightly said, the world of science is coming together with medicine. As we think these through, let's parallelly think through the strengthening of the system for screening, early detection, prevention, and a healthier ecosystem, which is centered around the patient, which has public-private partnership very significantly, and a seamless patient-centric connectivity, which is digitally enabled between the GP in a small village, the primary healthcare center, the diagnostic center, the high-tech hospital, whether it's government or private, so that the patient gets the most appropriate care. And this is enabled or hastened by telemedicine. This is facilitated by a personal health record. This is part of the vision of the National Digital Health Mission. So all these are things which are happening or beginning to happen. And so I'm very positive about where the future can take us. I think this is a time we are fighting the war of our generation. Let's respond with innovation, with new thought process, with a cooperation and a collaboration between all the elements. And I think we can do something very special. I want to say one last line about the need for enhancing the focus on the healthcare workforce. There is a global shortage of healthcare workforce. There is a potential for India to serve. A young India can serve a graying world, but first we must take care of our India. And here we have to double our doctors, triple our nurses, and grow by 5 times our paramedic. We need to enhance our super specialists, and we must use e-learning tools, partnership, modular learning, innovation that we have learned even during COVID. So during COVID, we did a COVID training program where 14 lakh people took that. And then we did a ventilator training program in partnership with Critical Care Society of India. So this had content, simulation, and a buddy system. So all kinds of innovation are happening. And the last thing is we do need further investment in the healthcare system to enable this vision. So coming together, focusing on all elements of affordability, accessibility, and quality, focus on non-communicable and definitely primary healthcare, and use digital as an enabler and an accelerator, and research and education as two important pillars. That would be my immediate take for now.
Thank you, Dr. Reddy. I think that is a good place to start. I think you've laid out one element of preparedness extremely well. Dr. Trehan, could we have your comments now, please? You're on mute, Dr. Trehan. Can you just?
That?
Thank you.
Okay. So good afternoon. And let me start. Sangita has laid out the full view of what needs to be done. But let me take a few steps backwards. And I'll start with the statement of Tom Friedman, the New York Times writer who wrote The Earth is Flat. And he said, you know, this pandemic is actually truly a war between Mother Nature and Father Greed. And if you stop, think about it, it starts unraveling itself in the sense that we have done everything in our power in the last so many years to destroy everything that was in the ecosystem which was protective to us. So if you're going to really look at where Sangita was saying we should go, we should also look back and say today there is not a single country in the world, no matter how rich or poor they are, who can afford to give universal health care of the proper or standard to all their citizens. Everybody's struggling. I mean, today, if it wasn't struggling, you can see how fragile these systems are. You saw what happened in the US, New York City, everything collapsed. London is collapsing today. I mean, people are not able to get into the hospital, and then they are being pushed out of the hospital. And if you, God forbid, if you are over 65, then you don't even have a hope to get any treatment. So there are many, many vagaries around the world which we must learn from. So we, of course, are totally underfunding our healthcare initiative or system. But the wealth lies in preventing disease. Wealth lies in health. So if we actually want our country to become a healthy nation, which I'm hoping it will happen in my lifetime, that within the next few years we can be proud of our system, that we need to pay equal attention, an equal amount of money, an equal infrastructure to be built into building health so that we can decrease the disease burden. If we decrease our disease burden, which has been successfully done by many countries, we would not require that build out in the medical system that we estimate today, that you got to double the number of beds, the number of doctors, nurses and all that. Maybe we can mitigate that because it is unaffordable also. So the basic point comes as we respect our environment, we respect our people, and there are two schemes of the government, Swasth Bharat and Swachh Bharat. They are two actually twins. To my horror, the two organizations don't talk to each other. So we need to do some real serious planning to say who is going to take care of the prevention part of it. Why do we still have sewers flowing through people's homes? Why do we have all these things? Can we not, at least for starters, get rid of that? Yes, there have been toilets, there's water and electricity coming. But if you still look at the areas, I've been into these villages, it's a horror scene. So we need to put one eye on that. And then one eye on the fact that we need to know in an early warning system and insist that countries like China do not play the trick that they played in this whole game. Now, whether it was deliberate or whether it was ignorance or whether it is man-made, what it has done is brought the whole world down on its knees, except China is making huge amounts of money. So that is another debate, which there are lots of luminaries here who are much superior intellectually, who can figure this out. But it raises many fundamental questions. So two things. If you comment on what the government did in the lockdown, where there's a lot of some people say yes, no, maybe, labor, this, that, these. No question in my mind that was the right thing to do. Whether it could have taken 3 days later or 4 days later or that same night, it's maybe we'll debate it for long times to come, but both of them have their traps. So on one hand, the labor got stuck wherever they were. The belief of the government was that the employers will take care of them, because at that time it seemed the lockdown was 30 days. And I must say, the civil society responded very nicely. They fed them, they housed them, but the housing, you should see, there were such wanton facilities that though after 30 days, the labor started feeling if we live in these conditions, we'll die here, we might as well go home and contact the disease. So this whole thing got a little bit out of hand. Now, if you had said, everybody, wherever you are, go home in the next 2 days, that would have created mayhem around the country also. So there's no right answer to that. That's what I want to say. The third thing is that it's a very good thing that there are many organizations, and also especially the government and the private sector, broke down many barriers and worked together. Like Sangita said, many things were repurposed. You know, we had no facilities for manufacturing good, decent or usable ventilators. We had no PPEs, but the private industry got together, the medical profession got together with them. We were already working on a prototype with the company Aqua. We accelerated the work. Maruti came in, they got, so manufacturing was done. Today we are exporting ventilators. So this is a good lesson to learn for our country. So anyway, I think that I hope pandemics don't come again in our lifetime, maybe 100 years later or something. But there is always this lurking danger that it is going to happen again and again. So clean up the environment, respect nature, get all the measures that Sangita talked about, we got to put them in place. But my emphasis is, as much as we build out the delivery system, we must put same emphasis into healthy India, because that is what will make it affordable for the future. One more act. India is today competing in the world with military powers, but India has a huge reservoir of soft power. Our IT is already there. Healthcare is the other big thing that Indian healthcare system has successful stories which nobody in the world has, or we can match anywhere in the world at 1/10 or 1/20 the cost. Don't forget, 4 billion people around us are even in worse shape than we are in, economically. So anything that we develop as delivery systems, remedies, telemedicines, IT, this will become applicable to many continents. So that is our opportunity to create systems which will also become applicable to those 4 billion people who today do not have healthcare, or not, maybe a little better or worse than us, but these solutions can be universal. So, and it will give India that soft strength that we have. Our doctors are the best in the world, no question. I have tested them everywhere. I was in the US for 20 years. You can hold a candle to them anytime, anywhere, from anywhere in the world. So we have that power. We should use it properly. Thank you very much.
Thank you, Dr. Trehan. And I'm extremely happy that you brought in the perspective of the environment, and also that you stressed on the importance of just, whether there is a pandemic or not, just focusing on making people healthier. And your comments on India being able to show the way by actually developing techniques and technologies that could work in mass scale and at optimal cost, I think is very well made, because there is the need of the hour. Dr. Guleria, could we have your comments, please?
Thank you very much, and thank you for inviting me to give my comments. The topic is building a pandemic-resistant world. I think it's something that is going to be very difficult to do. Let me just try and give you a perspective. For almost 20 years, we've been saying that we have a pandemic coming out on our hands. And this started way back in 1998 when we had an outbreak of what was known as bird flu H5N1. And that caused a huge number of deaths in poultry. And we were very worried that this virus, which has a case fatality of 60% and just needed two mutations to have sustained human-to-human spread, could become a pandemic. And then we had the SARS outbreak. Since then, there's been a lot of talk of preparing for a pandemic and trying to create a pandemic-resistant world. As a matter of fact, I've done workshops with the CDC on trying to see how we could prevent a pandemic, because in the early 2000s, it was felt that this pandemic would start from Southeast Asia and it will spread all over the world. As a matter of fact, CDC did a whole simulation on an individual who carries the virus and reaches the United States, Washington, and then there's an outbreak out there. However, why were we not able to do something when we had COVID-19? We had a warning with H1N1, swine flu. Luckily, it was a milder pandemic. And we've had so many outbreaks over the last few years. Talk of MERS, talk of Nipah virus outbreak in India, talks of Zika. There's been a lot of warning that we've had. And I think the basic issue is that there has been a lack of political and, let's say, policymakers' commitment. I remember having a huge discussion in the ministry when we had the Ebola outbreak. We must invest much more. We must have an outbreak plan. But again, once the pandemic tends to wane, the outbreak tends to wane, there is no sustainable effort. So if we need to have a pandemic resistant world, we have to work in a manner which is sustainable and which works even when the pandemic is over. And there are 4 or 5 things that we need to look at very aggressively. One is all countries have to come together to have a very good surveillance system. If we had a very good surveillance system and there was a proactive involvement, this pandemic could have been stopped much more earlier and probably contained only to China. We may not have the situation that we have today. So a surveillance where there is a lot of collaboration and understanding the magnitude of the problem, a collaboration both in data sharing and research, and that goes as far as containment is concerned. And that has to be done in our country also. We could have an outbreak in a certain region in our country like we had as far as the Nipah virus was concerned. How do we then develop a strategy of containment? Do we have the resources to do that? Do we have the trained manpower to really work on containment so that an outbreak doesn't spread to the rest of the country, considering the fact that we are now a country in which there is a lot of travel happening? And finally, I think what has been really raised is, have we really invested a lot as far as health is concerned? We have not, and that has been raised by the previous speakers, because our health infrastructure is already stretched to the limit. And when we have an outbreak like this, we really have no plan in place as to what we will do, both in terms of human resources, both in terms of the health infrastructure. How would we upscale our health infrastructure? Let's say once this pandemic is over and 10 years from now, we have another outbreak. We will still not be able to have the capacity to double our beds, increase our ICU beds. So I think we need to really start looking at what we can do. And this is where we need to innovate. And there is a lot of opportunity as far as telehealth is concerned, technology is concerned, to be able to innovate. And I feel that in the health sector, we have been slow to adopt a lot of technology, despite the fact that India is the IT hub as far as the world is concerned. In the health sector, we need to do much more as far as adopting technology so that we can reach out to even remote areas using technology that we have. We also need to have a big investment in what I would call One Health. One Health is something that we need to look at, because all of these infections have actually jumped species. Pandemics have occurred because of viruses having jumped species, and therefore from bird flu to Zika to H1N1 to Corona. So unless we look at health in a more holistic term, we will not be able to prevent outbreaks. We will not be able to even tackle the problem of antimicrobial resistance. And therefore, we must aggressively work on this concept of One Health. And there is a need to really look at this pandemic also as an opportunity. As has already been said, we've really been able to develop a health equipment industry, which we did not have in our country. And this was one of the weaknesses. We were very good in the pharma sector, but in the sector of making health-related equipments, from ventilators to monitors to CT machines to MRI.
Experiencing some buffering issues.
I think we lost Dr. Guleria.
Yeah, I think we are experiencing some buffering issues. We'll just give him 15 seconds probably to reconnect. Ajay, can we have send him a message, because I hope he realizes that he's sort of.
Yeah, I'm just talking.
Yeah, lovely. I think in the interest of time and in the interest of keeping the panel going, because anyway, I think he was coming towards the end of his comments. It made most of the points that I think he wanted to make. So I'm going to ask Dr. Gangopadhyay to go next. And um, you've heard everyone speak. I mean, they've spoken about health issues, scientific issues, the need for investment. And I'm glad Dr. Trehan brought in the lockdown, because I'm sure you've heard this theory that the pandemic isn't the black swan event. It is the lockdowns that countries around the world enforce that were actually the black swan events that sort of roiled economies more. Could we have your comments, Dr. Gangopadhyay, on how we can build a pandemic-resistant world?
Thank you, Sukumar. Let me begin by saying it's highly intimidating to me to be speaking in this panel where we have such eminent health experts, yes, including two of our finest doctors. So as an economist speaking on this panel, I have to be very careful, since all I can talk about is the health economics aspect of what we need to do, or what we need to do to be able to probably get to a pandemic-resistant world. Now, the points have already been made, but I just want to reiterate and emphasize some of those bits. So let me first begin by saying that, as Dr. Trehan said, a healthy economy will not only reduce the demand for healthcare services that we face today, but it will also actually improve the productivity of everybody, right? So health is something which is wealth, as Dr. Trehan mentioned. The second thing I want to say is, for a developing economy like ours, where we have such a large young population, getting them employment is a big issue that we have to deal with. And the healthcare sector, or the health sector, is the largest employer. And it's not the largest employer like we say, for example, the construction sector. It's the largest employer in a much bigger sense, in the sense of the different amounts of skills, the different types of skills, from the lowest to the highest, right, to the most high tech, and from the lowest scales. So it can actually address the entire unemployment problem that we are facing in the country today if we start investing in health. Forget about the benefits of having a healthy economy. It will also actually buttress the economic engine if we start focusing on the health sector of this economy. So these are the 2 points I wanted to emphasize. The second thing has also been talked about, and that's essentially what economists today are discussing at length, which is this trade-off between efficiency and resilience. Now, I'll just mention 2 things over here. One is, if I look at the data globally, in certain countries, they ask companies to declare their environmental and social indicators of their businesses. And so they call them ES, right? I'm not talking about the G part of the ESG, so we'll just talk about ES, environmental and social parameters that businesses are rated on. And it's surprising to find that during this COVID crisis, companies that had high ratings in ES also perform better. So in that sense, the more holistic we start treating businesses as, it actually generates more resilience, right? So for private companies, and this has already been mentioned, especially the way the private companies came forward during the emergency, during this pandemic, was remarkable. So we now have to institutionalize this so that it becomes a way of doing business, right? And for that, businesses have to be rewarded. Now, what we see in this data is that the market is already rewarding them. So now it is up to the government or the institutions around them to also reward them so that it becomes a particular aspect of the way businesses operate themselves. The second point I want to make on this issue between efficiency and resilience is that, again, if we look at the data, we find that countries which have greater healthcare resilience are also the countries which have an insurance mechanism in place. And what do I mean by the insurance mechanism? I don't mean, which Dr. Reddy had already referred to, and that's a well-taken point. But I want to raise the other aspect, where the insurance is being built up by the providers of healthcare services. So, for example, if I look at the bed occupancy in various countries, the countries that had lower bed occupancy, that is to say, were in essence inefficient because they have large unused capacities, actually fared better under the pandemic than those like the UK, which also has a national health system, right, which had very little give in their bed capacity. Now, this is exactly like insurance. If we think about it, we pay car insurance every year, and we probably never have an accident throughout the year. But if we were to say, therefore, it's a waste of money, then we'll be making a big mistake. So when it comes to healthcare, we have to generate, to be able to be pandemic resistant, we have to be able to generate more capacity than we need or use on a daily basis. So when we talk of health investment or investment in health, that's why the government has to play a much larger role. When we talk of investment in health, we are not just looking at efficient risk and return profiles, right? We're also looking at the longer term risk that we are discussing here today in terms of these black swan events like pandemics that may happen at any time, right? So these are the two things I want to emphasize on efficiency and resilience. And the last thing I want to say, which has also been mentioned, but as an economist and a researcher, this is music to my ears, is that we need a lot more research, not just in health, which is happening, of course, but also on health economics. Our research on health economics is abysmally poor in this country. And one of the reasons for that is what has also been referred to by an earlier panelist, namely Dr. Reddy, that data. The availability of data, the silos that Dr. Trehan talked about that we work in, not being able to string the data along, connect the data sets that we have. Now, India is a very, very potentially data-rich economy, but in reality, it is a very data-poor economy. We don't use data in our policy making, we don't use data in our strategizing, we don't use data in our planning mechanisms, right? So all of these can only be done if, as Dr. Trehan talked about, if all sectors of the economy come together, because health is not a sector. Health is a fundamental thing in the economy. Right? It has huge ramifications through every single aspect of society. So we cannot just treat health as a sector. And we need a lot more research, a lot more multidisciplinary activities, using the data, using the experience and knowledge that our fine health experts have already put together, and proceed. I think this is a huge opportunity for us. This COVID-19 has forced us to rethink everything. This is a huge opportunity which we cannot let go waste. I'll stop there.
Thank you, Dr. Gangopadhyay. Dr. Guleria, welcome back. I'm sorry we lost you while you were, I think you were winding up your comments, but I'm going to give you an opportunity to finish what you were saying.
No, I was just winding up. So I think most of what I wanted to say has already been said. I just wanted to say that we need to focus also on research, and that has already been built up. And secondly, look at this as an opportunity for economic growth, because there is something that we can take out of the pandemic, that if multi-sectors come together, and then there can be a lot of economical growth, whether it be in the medical industry, whether it be telehealth, or whether it be trying to use our overall infrastructure to provide better quality care. So I think this should also be part of what we can take, learning that we can take from this pandemic going forward in building up a pandemic resistant world. Thank you.
Thank you. I think we've got a fairly a reasonably clear picture of what we need to do, not just from the health perspective, but also from the environmental perspective, from the investment perspective, a little bit from the economic perspective. But the point that Dr. Gangopadhyay made about research and health economics is very important, and he stressed on data, and I'm going to use that to get into the second part of this discussion, which is really going to be the discussion part of it. Data and science in many ways have to guide our response to this pandemic. They're the only two things that matter, because everything that we have to know on how to respond to this pandemic, and also the way in which we measure what's happening with it, has to do with data and science. And as a country, and I don't mean this as a critique or something, but as a country and as people, we are very uncomfortable with data and science. We are very comfortable with technology, right? I mean, we all love these black boxes, but we are very uncomfortable with data and science. So I'm going to ask each one of the panelists, because I think each one of you will have something to say on this. How do we go about this? What do you think we should be doing now? And I'm going to start with Dr. Reddy, because I think she wants to say something. Dr. Reddy, you're on mute.
Yeah, so it was, very interesting that you said, I want to say something, because I've been speaking about the importance of data for many years. And I think the first thing, which is a building block, which I don't know how many people know, but this was a building block which was laid in the country a few years ago, which is that you cannot convert data into information and information into knowledge, and that into actionable insights, unless you do a standardization of that data. Because what one medical person calls myocardial infarction, the GP calls heart attack. So how do we get this data together to create what is the semantic interoperability? And there is one methodology which is very tech savvy, which is emerging now. There is NLP and other methodologies. But the important thing is standardization of data. And India adopted, and I was one of the recommendatory councils on that, what is called the SNOMED coding system. And this is then being now rolled out by CDAC, and Apollo has been working with them. So you have the ability to use the coding, the automated coding, but there is a language chosen. And now there are other methodologies of standardization, the labs in the Loin Code, and the National Digital Health Mission is working first on standardization of data. Then there is the interoperability of data. How do you take data from one silo into another? And then there's the presentation layer of data. How do you see that data and what are the permissions involved? And then there's the privacy aspect of data, and how can we follow a privacy framework yet use data for public good? And within this environment, things are happening now so that we can convert. I think Dr. Shubhashis made some amazing points, and I actually want to go back to the other amazing point he made, which was on the need to have a larger amount of an ecosystem
Capacity.
of that was a capacity was a very amazing point. But coming back to this one of the ability to use the Indian ecosystem and the volume of data to create or to leapfrog the methodology of use of data in the healthcare system. So I often, people say that doctors adopted, technology late. And I said, that's not true, because when the cath labs came and the CT scans came, our doctors knew how to use them very quickly. The software environment and the technology environment was not appropriate for the for the price compulsions that we had in India. Now that we're building our ecosystems, you will see a proliferation of data and an ability to use this data to merge into algorithms which will guide health systems. So, I know I'm laying out a fairly complex thing, but it's important for people to understand that there is a background work behind this. There is a positivity to using this data. And I'll end by saying that using the biology, which is about the body and the genome, the bytes, which is the computing capacity, and the bandwidth, which is the connectivity. By using this, we can enable a distant rural environment to have a second opinion service with the highest end doctor using telemedicine. We can compute and transfer an X-ray slide and teach and train in distant parts. This is a combination of the bytes and the biology. And we can predict using the biology, the bytes, and the bandwidth. So this importance will enable the skill, will put the skill which is available in a few super specialists' hands into many doctors' hands. So it will democratize healthcare in an amazing manner. So this journey is just beginning. It will unfold, and it's important for India to build these solutions for ourselves and share these solutions with the world. So there's a really, multi-dimensional opportunities in the use of data in healthcare.
Thank you. And you referred to the point that Dr. Gangopadhyay made on resilience and capacity. And as he was speaking, I was thinking of Germany, because I think he had Germany in mind, because Germany benefited from the fact that they had a large number of critical care beds, as they call them. But now, in the second wave, it's interesting because Germany is facing a shortage of staffing, right? I mean, the soft infrastructure, the fact that they don't have enough healthcare workers. So the resilience that he spoke of isn't just in terms of building capacity, in terms of equipment, but also building capacity in terms of healthcare workers, a point that
Which
you
I
made
was
and a
saying,
point that
you're
Dr.
right.
Trehan also made. Yeah, and in the absence of that, it's not going to work. Dr. Guleria, you mentioned surveillance, and you mentioned the fact that we need to really know what's happening. How do we learn from this going forward? Because one of the things I want to leave the audience with is, because we've promised them that we'll at least give them some hints on how to build a pandemic resistant world. What do we do to get a proper surveillance system in place? And you made the point that it needs to be global. And you know better than any of us that all countries don't share information very easily. Even in this particular case, the quality of information that was coming out of China, and I remember in the early days of January, China insisted and the WHO believed that this could not jump from human to human, that human transmission was not possible, and it was only later in the course. And there were so many missteps which could have been avoided by better surveillance and better communication. I know that Dr. Trehan said, hopefully we won't have a pandemic for a long time. But what if we do? What should we do from the surveillance point of view?
So I think it's a very important point that, as has already been said by Dr. Sangita Reddy, we should have data sharing. And when we're talking of data, it's important that this data is shared not only at a national level, but at a global level. Unfortunately, we tend to work in silos. Even if you look at India, there is a lot of data available in our country. Data by the IDSP, the data by ICMR, but they work in silos. There's really no comprehensive sharing mechanism at a national level, and even from the private sector and the public sector. So unless we develop a mechanism nationally and globally where there is transparency and a willingness to share the data and willingness to have experts look at the data, because ultimately the data has to be analyzed properly also. A lot of data may not really be of that much use unless it is properly looked at or analyzed properly. So I think that has to be built in at a global level, because I believe that unless we prepare, we will have a pandemic in the very near future, because let's look at the outbreaks that we've had in the last 10, 15 years. There have been a number of them which have been sort of hits and misses in terms of a pandemic. Each one of these could have become a pandemic. So if you look at the number of outbreaks that we've had, and the world has become smaller, there's such a lot of travel happening. Viruses can travel from one place to the other during the incubation period, and you can have a huge outbreak in an area where the doctor is not even suspecting that this could be an infection out there. This is the classical history of SARS. SARS traveled from a patient from Hong Kong all the way to Canada, and for quite some time the doctors didn't even suspect that this could be a novel infection, and a lot of healthcare workers died because of that. So where there has to be now a lot of data sharing and planning. We could look at even a central surveillance team globally, which could be looking at data coming in from all parts of the world and seeing for any spike in or abnormal number of cases being reported, which could therefore lead to a global investigation, and some sort of a planning like that may be useful. But I think we also need to look at data sharing even in our own country, because it will help policymakers to move forward in terms of what are the gaps and how can we really help. And I think that will really help in providing healthcare which is available to everyone with equity, even in rural India.
Uh, Dr. Trehan, one of the things you must have noticed is the speed of response from the healthcare system. Um, how would you rate it? How well do you think, given the fact that there were so many unknowns about this pandemic, how well do you think we reacted to it? And because we have to learn from this, what do you think we could have done better? Dr. Trehan, you're on mute.
Okay. Uh, you know, the leading point here is that this is a new experience. In our lifetime, we really had not seen a pandemic. We read about the Spanish flu, we knew certain facts about it, but like Dr. Guleria said, there were warnings here, there, but they actually got contained by themselves or by whatever action was taken in those areas. We really never got a hit on the head with that. We all saw parts of it. This is the first time that the whole world has been shaken from the roots. So the question is, this experience needs to be translated into something meaningful for the rest of our lives, so that we do not get lost again. We were quite lost here, because this is another, we thought that it only gets accumulated in the back of our throat and nose, goes down into the lungs, destroys the lungs, and that's basically the whole mechanism of people dying. Thanks to those 50 autopsies done by Italian doctors in Bergamo, they actually established the fact that it is not that by itself, but a huge cytokine response that was actually inflaming every organ of the body and including and causing thrombosis. Now, if that hadn't happened, today our mortality would be 5 times, 10 times that of what it is today. So all these experiences exchanged. So I hate to say it, but the only culprit in this whole pandemic is China. The rest of the world responded quite well. And I don't know whether we'll forget it or whether we want to punish them to make them remember that this is not on, that you have caused so much devastation around the world. It's not life, economics, everything. And so the point is that we must not let this happen again. The countries or anywhere, they should know that there is consequence for concealment or perpetrating whatever is your thought. So we don't know. I'll hold the jury on that. So my point is that data, very important ingredient, but data, as Dr. Guleria said and Sangita said, that the purity of the data, the honesty of the data, the ability to analyze it and come to the right conclusions. There are so many studies we see, when you look at, we go at a granular level, the conclusions may be totally faulty or biased. So the data has huge value, and I can't forget one sentence which our social department professor said while we were in medical college, and he says, there is statistics, there is lies, and there is damn lies. He says, you have to decipher between the three and learn that in your life. This was way back 45 years ago, whatever number of years. He said, this still sticks in my head. The data has to be looked at because what you put in, your sincerity of thought has to be right from that point. That what you are allowing to go into the database is actually is the truth. Because people are afraid of the truth. I give you the example. We have tried like hell. Why don't all the hospitals put their results on the web so that the patient can transparently look at what is your outcomes? Nobody wants to do it. I mean, one or two of us did it and then that was it. It was not followed. So what I'm saying is that these barriers and mindsets have to change. I want to also add what Dr. Gangopadhyay said about jobs. I think it's a very, very important part, and I don't think it has sunk into the thinking of the government. If you take a hotel, for every key to a hotel, you need 2 employees. For every bed of a hospital, no matter how primary it may be or tertiary, at least you need 4 to 7 people a bed of different skills. And each one of them is already above poverty line. So you see the value of what you're doing. You're making a nation healthy, you're improving the productivity of the nation, and also you're providing bread to millions and zillions of people. So if you look at it, there has been a certain amount of suspicion, you can say, that there has not been a real confidence exchange which is building slowly, and this pandemic has, I think, helped to build the confidence between the government system and the private system. We are all Indians first. Every facility that stands on the ground of India belongs to India first. It belongs to us later. That be so, we must work together to create that what we created it for. So the created was that, okay, we did it to provide the highest end of care. There should be transparency at every level, but also the realization that there is private investment that has gone into the building of the system, and there must be returns to service the investment and to give some bread to the people who created it. Now, once we mature to that level, you will see India's healthcare system will become much more vibrant, much more together. There is always this tussle. So much time is wasted in this tussle of what is the right price, what is this, who's going to finance it. We should be, it's one stack. It's not divergent. And if you talk about pandemic resistant India, that's what is needed. That stack has to be built from ground up. Everybody does what they do best. Primary healthcare, prevention is government's domain. Keeping the sanitation, all that stuff alive is the government's job. Primary healthcare, secondary healthcare, there is a good network, and it primarily resides in the government space, but certainly private sector can be associated with it to help wherever help is needed. Like we said, if the government has decided to make 150 the wellness centers, 150,000, which is a great thing in this Ayushman scheme, and wherever you're finding it that there is help needed, we could volunteer from the private sector to adopt a few of them, service them.
Sure.
Technology will enable us to connect. So what we are saying is building blocks need to be put in place in tandem with each other, not in divergence with each other. And India, within the next 5 years, could be proud of a healthcare system. And I think that's the important thing, because huge amount of employment, huge amount of relief, huge amount of productivity, and huge amount of ability to fight future pandemics.
Dr. Gangopadhyay. Yeah, Dr. Gangopadhyay, I was hoping you would also comment on self-reliance and protectionism? Because you've seen, I'll elaborate this a bit. At one point in time, India used to be a huge manufacturer of bulk drugs, and many of these bulk drugs go into key medicines. And over a period of time, a lot of that business moved out. Much of it is now controlled by China. There are very few bulk drug manufacturers in this country anymore. When there is a pandemic, and especially a pandemic like COVID, which among other things disrupts supply chains, you find a lot of critical equipment manufacture also being hurt. Masks, for instance, in the US is another example. I mean, we've all heard of this fascinating story of how US federal agents intercepted a shipment of 3M masks that were headed for another country somewhere in Asia and had it routed back to the US. Do you think that part of building a pandemic resistant world is also going to involve some amount of guidance by governments to companies to industry on what needs to be made locally, on keeping supply chains local? Do you think that's a possibility?
That could be a possibility, but that's not the place to start from. The place to start from is you first strategize what you want in your healthcare sector. What are the objectives of your healthcare sector, right? First, you strategize on that, and then you do whatever needs to be done to get there, right? This piecemeal thing and ideological debates on whether we should be protectionist or not, whether we need to do this or that, whether it's nationalism or not nationalism enough. I think these are destroying our ability to sit down together and come up with a solution. I didn't want to speak about those at all because that completely dilutes the discussion that we are having here today, which is how can we use, what is the significance of the healthcare sector to our society? Question one. Question two, how do we ensure that we reach our objectives of the healthcare sector? And the most important thing, how do we strategize to get there? So the questions you're asking is at the last stage when we are formulating our strategies. And over there, obviously, you do whatever you need to do to be able to address the first two. So unless we look at it that way, if we separate out, parts of this entire system that we're looking at, right, we are bound to get inconsistency, contradictory outcomes, and end up in a mess. So I don't think we should start from there. I don't think there is, as we saw in this panel, there is no disagreement on what the health sector should do. That's our starting point.
Excellent. I'm going to, before I move on to questions, and there are a few questions that I want to take from the audience, I'm going to give each one of you 30 seconds to speak about the one or two things that we should, just the top two things that come to your mind in building a pandemic resistant world. Just the top two things. It could be, you could just re-emphasize some of the points that you've made, but I think it's important to sum up what you think needs to be done. We'll start with you, Shubhashis, since you've been going last always.
Oh, that's okay. So I didn't have to come up with anything new. But now I have to. So there are just quickly two things I want to say we need to focus on, which I haven't touched on. But I think it's important to keep this thing in mind in the way we are planning. It's that we cannot use the technology for the healthcare sector, right, in the way we are doing it. We have to adapt the technology for our needs. I think there is a change in the approach that we must have. We cannot just borrow solutions from elsewhere and put it in. We have to, because the healthcare sector is extremely, what we call in economics patron-client relationship, right, between the healthcare provider and the and the client, right? It's a very, very idiosyncratic relationship. Uniformization is very difficult, right? So we must, technology standardizes, yes, but it has to take these things into account and it adapt the technology to be able to do that. So which parts should be standardized and which parts should enable people to behave in a more idiosyncratic fashion is important to understand. The second thing I want to say about this is that we have been arguing a lot, and that's why, Sukumar, I want to say we need to strategize. We have been arguing a lot about how the new technology and AI and all of this is going to affect our labor market. We are forgetting that in the healthcare sector, we have shortage of personnel which technology can address. So instead of talking ill about the new technology, we should start using it to address some of our shortages, right, that we have in personnel. So these are the two things I want to say.
Excellent. Dr. Guleria?
So, besides what I've already said, I just think two things we need to keep in mind when we're looking at a pandemic-resistant world. We've already discussed surveillance, containment, and collaboration. I think the important issue is to also keep in mind that currently health is an expensive sort of investment, because the cost of healthcare has gone up dramatically over the last 20 years. From what it used to be during my time when it was predominantly clinical medicine, it has become more and more investigative medicine. And there is a lot of investment, whether it be getting a CT scan, an MRI, a whole gamut of tests done, even a PET scan. So we have to look at how can we be innovative. And I think in our country, there is a whole role of what I call frugal innovation, that we need to see how can we innovate in making our own strategy, which would be useful. Because if we want to have a pandemic resistant world, we have to do it in a manner which is cost effective and which is tailored to the needs of our country, and which can then work with other countries in sort of collaboration. So this is another point that I wanted to make. Thank you.
Thank you. Dr. Trehan? Dr. Trehan, your mic, please.
We talk about connectivity, we talk about surveillance, we talk about sharing information. The world has spent huge sums of money creating WHO. Now, WHO is controversially failed us, or did not fail us, but it looks like it did in this current situation. It was always behind the 8 ball when there could have been warning signs put out very early. So I think that instead of being hands-off WHO, all the countries should make it more accountable, more robust, and not let the people who are heading it be dependent on one country or the other's economic contribution to them to be able to, because this is what is very apparent what happened in this pandemic, that there was special interests and it all points in the same direction, and it has had its influence in many places. What their interest was in suppressing this information, we don't know, but I hope the world doesn't forget it, because it has caused huge damage around the world. I mean, this is a devastation which the world did not deserve. So anyway, point is, WHO accountable to in every way of its participation. Some of the studies they have done also are suspect. Some of the what they espouse is also suspect. So at least we know that there is some question mark about their ability. It may not be bad intention, but their ability to do their function properly. So my thing is, we have spent the money, hold them responsible.
Perfect. Dr. Reddy.
So I want to, kind of re-emphasize the very important point made by Dr. Guleria in the context of the fact that the whole world gets affected, and therefore this ability to work together, WHO, of course, strengthening, hold accountable, but also a concept of a health reserve workforce, which can be deployed seamlessly across borders, is one more additional point that can be considered. So you bring the world together in a positive manner, saying that this is a global problem and whoever has it, we will help. So it becomes a positive response to a crisis of one part of the world. The second point I want to make is that in this policy making, coming back closer to home, is that guidelines is one thing and implementation on the ground is another. And the disconnect between center and state and the implementation at a district level is a reality. As someone who's operating, across the country, we had hospitals, we had 2,600 beds working, clinics in every state. The interpretation of the central guideline to the local policy, we need a strategy so that we can, streamline that a bit. It would have saved us more time. The last point I want to make really is also a slightly forgotten but very significant point, is the importance of mental health. That so much of this, we're looking at the physical aspect, but there's been a huge underlying mental health issue which needs to be addressed. And finally, and probably most significantly, is I hope that we come out of this pandemic with the appreciation that health is not the government's problem or hospital's problem or public health or private health or even the individual. It is society collectively and the world collectively. Because even if one individual does everything to protect themselves from the pandemic, if they walk out and that person is not wearing a mask when they go out, they're going to get it. So this is society, this ability to say health is a collective societal responsibility will, I think, help change the thinking. And then we start spending enough, behaving better, being proactive about prevention, from food to noise pollution to environment. Many things will fall in place, starting with the appreciation of a collective responsibility. Thank you.
Thank you. We had a couple of questions. Both of them had to do with affordability. I think it's an issue that Dr. Guleria has answered. I think he's answered it at a much more macro level. We are also running short of time. I'm going to hand over to Anubhuti, but before I do, thank you very much, Dr. Reddy. Thank you very much, Dr. Trehan. Thank you very much, Dr. Guleria, and thank you, Shubhashis. I think you were all brilliant. I learned a lot, and I'm hoping that policymakers have also been listening to this, because I think what we have at the end of this discussion is the beginnings of pointers to a blueprint for what we should be doing with the whole public health system, which requires a lot of investment, requires complete reinvention. So thank you very much for making those points. Anubhuti, all yours.
Thank you so much, Sukumar. And it's just been a very exciting session. And I was kind of thinking that, it will be one of those discussions which would highlight just the learnings and, how we've been facing the whole challenge on the pandemic and how to overcome. But, some of these highlighters that I want to mention while I do my closing remarks is that the way data analytics and multidimensional opportunity for using data around the health sector has been portrayed by all the doctors here. I think the policymakers and the government must pay attention to that. And that looks like a very critical component of solving a great amount of this problem. And, which then leads to that surveillance aspect, which was the main point that was brought out by Dr. Guleria. And then patient-centric connectivity, not that we are not doing it, but, we have to kind of do it much more aggressively. I think that's what is going to connect those dots which we are missing out on, and we've seen them on ground during these times. An enhancement of healthcare workforce, of course. And then research on health economics was a very interesting point. We don't see much of that work at all. And that's going to come and build some of these things in. And then in institutionalization of business, which is happening, but we don't see it so much happening in the health sector. And the way Dr. Trehan said that, we've seen a showcase of this during this situation, and we must continue to enhance it. And innovation strategy, which can be cost effective, medical infrastructure. And not to forget what Dr. Trehan emphasized, that, cleaning up of environment and respecting nature, very, very crucial. So I think absolutely an engaging discussion, a lot of takeaways from this particular panel. And we hope we look into some of these points and move forward with this. With this, I would really like to thank everybody. Thanks a lot. And very, very interesting and knowledge-oriented session. I would like to thank on behalf of PAFI, each one of you. Thank you, Sukumar. And you ended it right on time, which is a challenge usually with such panels. So congratulations for that. I would also request all the participants to stay connected as we'll soon begin the next session at about 1:45. So thank you once again. Thanks a lot and have a great day.
Thank you. Thank you, everybody.
Thank you.
Thank you all. Stay safe.
Thank you.
Take care. And happy Navratri. Namaste. Bye.
Thank you.
See you, Dr.
Dr.
Trehan. Good seeing you.
Yeah, good.